we are presenting COVID Search, which is an international cohort study. This is a sub-study of a pan-cancer study during the first wave of the pandemic. COVID Search for Gynecology Center, there were 227 centers in 55 countries involved. We kind of audited and completed the study for just under 4,000 patients with gynecological cancer. It is the largest completed international multicenter study. Importantly, 1 in 4 of the patients were from low middle income countries. We know that in our cohort, the COVID-19 infection rate compared to other solid tumors was quite a bit lower. Unfortunately, 1 in 5 patients had their care altered during the first wave of the pandemic. 1 in 13 didn't have their operation, and 1 in 9 actually had prolonged wait for the surgery for more than 8 weeks. And that was actually linked with worse outcome. Moving forward, we know that surface disruption is still really real and alive in many countries. Mitigation factors in a higher level, especially in terms of resources, is really needed, especially internationally. There is a kind of finance constraint. So I think this is a great reminder that the effect of COVID is not over. We still need to think about patients affected by the COVID-19 pandemic. On the other hand, on the positive outcome, we now have an army of researchers used to doing this type of study in countries that are not as set up for research infrastructure. So there are new collaborations coming up that is utilizing this existing network in order to help kind of further the care of gynecological cancer in different countries.